Welcome to Healing from Complex PTSD. My name's Linda. I'm an advanced certified trauma recovery coach, and I want to give you some insight and information on trauma recovery coaching today. And I hope that you find the information certainly educational and help you understand, is this a decision I'd like to make for me and my recovery? And also to give you a link where you can contact me or ask questions as well. So I'm Linda, and I understand how you're feeling and what may be happening for you right now. So I understand your health may be suffering significantly. I understand you've been looking for real answers and effective treatment for complex PTSD. And I understand if you've not found it until now. And it's quite normal, even though I use that word a bit loosely because we don't want it to be normal, that you haven't found the help you need now, as in I hear from many people who've been in therapy for decades and it hasn't worked for them. And we'll go into that a bit more as we go along. I see you and the pain you've had to hide away for too long, okay? Hiding it behind a mask. I know I used to do that really, really effectively. I hear your story that lies hidden deep inside of you, waiting to be heard and validated. I understand why this can be very confusing and you've not found anyone to genuinely help you. And I care that your heart's desire to be fully known and fully accepted in a safe environment is an experience that we can make happen. So why haven't you found answers until now? Now, the reality in life has been that mental health professionals globally are not trained in complex trauma at college or universities all over the world. I've had psychologists still do as clients, and all of them from all over the world, and all of them have told me how they are not trained in trauma and certainly not complex trauma when they're at university and college, okay? So if you find somebody that's actually qualified, they will have gone on to do further study, okay? The second reason why is the DSM-5 does not list complex trauma as a separate diagnosis, despite many trauma professionals over many years attempting to make this happen. On the 1st of January next year, the IDC-11 will be the first professional standard to recognise complex trauma as a separate diagnosis. And mental health professionals have been using talk therapy for decades. Due to the impact of complex trauma on our brain, talk therapy does not work as an effective solution. Also, a lot of professionals have yet to hear about complex trauma. It's quite normal in our global Facebook group to hear that somebody goes to a new therapist and they don't know what complex trauma is or complex PTSD. And we're ahead of the game out in the public arena just by the education that goes around. Okay, so it's not your fault. Answers have not been available globally until now, and the neuroscience is very, very real, very real. It's very real, but it's also very recent into the public arena, like less than 5 years since we've had access to information as professionals, but also as people in the public arena that want to study it as well. So I just want you to take a moment now and place a hand on your heart and push your breath out. So literally you take a and keep repeating it, just so that you can begin to sense that ease around how this is not your fault. You haven't known, and nor have mental health professionals known, how to work with complex trauma, okay? So I want to welcome you to Complex PTSD Recovery, where I understand what's happening for you because I've lived it too, okay? I'd been searching for answers for many, many decades, and I had done so much internal work, and it wasn't until I began to study the neuroscience after I got my coaching certification, and then everything began to fall into place for me. And now I've developed ways to effectively treat complex trauma to help heal our brain, because I lost all my cognitive function. I had no ability to walk, talk, feed myself, bathe myself, and I literally had a full-time carer. So I understand how it can take away from our health to the point that we're either highly functioning and our health is not good, or you find me and you're like, I've tried everything and nothing is working. And we get you on the path back to recovery. Okay, so in amongst the decades I spent searching for answers, I've covered the whole spectrum of inner child to meditation and so much more. And as I said, it wasn't until I studied the neuroscience and developed ways to understand and retrain my brain that I've actually experienced genuine recovery. I know how it feels to not have answers and to want a good quality of life. So our unconscious brain was programmed to life is overwhelming and unmanageable. Working with me helps you experience how life is functional and manageable. It's the experience in a safe place that changes our perceptions and helps to heal the psychological wound. Not revisiting the past helps the mind, body, and brain feel safe to release the past as you experience the here, now, today. Essentially, as we work together, you break free from the seemingly never-ending chaotic emotional cycle. You have access to the Heart of Recovery courses to help you identify more quickly the processes and outcomes the brain is driving in your daily life. Homework is set, and whilst at first it can feel a bit challenging, once you get into the swing of doing it and seeing the results, like you feel inspired to do more so you can achieve your quality of life. When you work with me and do your homework in the space of 10 weeks, you can experience an increased quality of life not available to you prior to complex trauma coaching. And that's because I have clients who do the program already with me, and that's what's happened for them. They've come and they truly believe there's no hope for them. And I'm like their last stop. And then inside of 10 weeks, we've got them back to functioning and beginning to be able to actually address what's happening for them in their recovery in their daily life. So trauma coaching is available online globally via Zoom. If you need help with the cost of recovery, please reach out via the contact form for alternative options available to you to begin an effective recovery. The contact form is on my website for any questions you may have, and I will reply as quickly as I can. So depending on my schedule, it could take 24 to 48 hours And due to time differences, I'm in Australia, and it can feel a bit like, how are we going to manage this? But I promise you we can manage it. I see people literally from all over the globe as clients, so it can be done. So I hope that gives you a bit of insight into what's happening, why you've been where you're at, and please feel welcome to join our global family at any stage of your recovery. Pardon me. And I hope to see you soon. Bye for now.